I am Dr. Mustafa Barbhuiya. I work as an assistant professor of pathology, healthcare delivery, and population sciences at the University of Massachusetts Medical School, Baystate Health. I am also founder and director of Foundation for Advancement of Essential Diagnostics in India and USA. Point of care testing is an exciting domain in the field of clinical laboratory and in vitro diagnostics. So the opportunities are huge. We live in a post-COVID world where we have seen the capabilities of point-of-care testing services and how we can serve patient population through faster testing. In brief, to define point-of-care testing are the tests that are being performed outside the main clinical laboratory in doctor's office or somebody's home, or it is done in the self-test. However, there are challenges. One of the major challenges is how do we ensure quality of those point-of-care testing? How do we ensure that these testing are being utilized appropriately by the patient population if they are doing it in the home or if it is self-testing? Sometimes the interpretation of results can be very difficult for those people who are doing that at-home test. In physician's office, the challenges are oftentimes the people in the physician's offices are not trained clinical laboratory professionals, so maintaining the quality remains a huge issue. Additionally, this point of care testing in fact gives us huge opportunity to implement World Health Organization's recommended essential diagnostics list in low and middle income countries where there are resource limited settings and many community health centers in the villages may not have electricities. We do need those handheld devices to perform point of care testing. The essential diagnostics list has been recommended for implementation for global health by World Health Organization in 2018. In a nutshell, this list was adopted from a 2016 model paper in New England Journal of Medicine, where the authors in that model suggested that the global population needs an essential diagnostics list tailored to the essential needs of essential medicine list because those tests will be used for either prescribing those medicines or monitoring those medicines. So the essential diagnostics list has been widely adopted, and the fourth revision of the essential diagnostics list is currently ongoing. However, the real benefit of World Health Organization's recommended essential diagnostics list will only be harvested when every nation will have their national essential diagnostics list, and that needs an enormous amount of work. I set up a non-profit foundation for advancement of essential diagnostics to help achieve and augment those goals globally across the nations. As a clinical biochemist trained in Johns Hopkins School of Medicine for over 5 years and undergoing a clinical fellowship in Penn State College of Medicine, and reading and listening and shadowing to those people who modeled essential diagnostics list, I realized that I can have also some impact through my experience around that. And as I come from a developing nation like India, where there are lots of needs to augment those essential diagnostic services across India, I thought that I would set up a non-profit foundation that I call it Foundation for Advancement of Essential Diagnostics. Right after World Health Organization actually published the first list of essential diagnostics, I set this foundation up in India. It is a Section 8 non-profit R&D organization incubated right now in Indian Institute of Technology, Guwahati, and we are trying to augment and popularize and help implementation of Indian Council of Medical Research recommended National Essential Diagnostics list across India to begin with in Assam. We have already set the stage for completing a needs assessment and gap analysis of 6-layered National Essential Diagnostics list in different states in Assam. As a small initiative, we have also initiated a mobile TV diagnostics lab in collaboration with State TV Cell in Assam, and we envision that we will provide a foundation-led model for clinical laboratory systems that will help augment the existing infrastructure of essential diagnostic services in 6 layers that Indian Council of Medical Research recommended in their policy recommendations in 2019 while adopting the World Health Organization's Essential Diagnostics list. And one important aspect of Indian Council of Medical Research that mentions there is a need of a public-private partnership model where we can augment the existing healthcare system through private participation within the public systems.